Hi guys, welcome back to my YouTube channel. If you're new on this channel, welcome. If you're a returning subscriber, thank you for always watching my videos. I really appreciate you. So in today's video, I want to talk about vital signs. Okay, vital signs. So if you visit the hospital, they will ask you to go to the vitals table so that the nurses will take your vitals, but then you do not know everything that vital signs entails. So in today's video, I want to teach you everything you need to know about vital signs. Okay, so please stick and stay, don't go anywhere. I'll be right back.
I want you to stay till I'm in the grave. Till I run away, dead and buried. Till I'm in the care.
So what is vital signs? So when we talk about vital signs are the measurement of the body most basic functions. Okay, so it is the basic functions of the body. Vital signs has four major components, and these components are temperature, pulse, respiration, and blood pressure. So we'll take it one by one and then I will explain everything for you guys. So when you talk about the body temperature, in layman's term, it is the measurement of the coldness and hotness of the body. So basically that is temperature. So with the temperature, the normal range for temperature is 36.2 to 37.2. That is the normal range. So if your temperature is above 37.2, let's say if your temperature is 38, 39, then it means you have hyperthermia. Okay, you have hyperthermia. And if your temperature is below 36.2, let's say your temperature is 34, 35, it means you have hypothermia. So hyper is higher and then hypo is lower. The body temperature can be taken orally in your rectum and then axillary. So the axillary one, that's your armpit. The axillary one is the most popular one that we mostly do at the hospital. So the number two component is the pulse rate. So the pulse rate is the measurement of the heart rate, or it is the number of times the heart beats. Okay, so that is pulse rate. And then the normal ranges for pulse rate is 60 to 100 beats per minute. So the normal range for the pulse rate is 60 to 100. Okay, so if your pulse rate is more than 100, then you have tachycardia. But if your pulse rate is lower than 60, then you have bradycardia. We have so many places that we could check your pulse rate. Okay, but then the common one we use is the radial artery. That's what we use mostly at the hospital. The third component is respiratory rate. Okay, when we talk about respiratory rate, it is the number of breaths a person takes per minute. Okay, the normal range for respiratory rate is 12 to 20. Yes, so let's talk about the fourth component that everybody knows. The fourth component is blood pressure. So when you talk about blood pressure, it is the force of blood pushing against the artery wall. Okay, it is force. So in BP we have systolic and diastolic. Systolic is the upper one and diastolic is the lower one. And then the normal range for BP is 120/80. 128. So if it is more than 120/80, it means the person has hypertension. Okay, and if it is lower than 120/80, it means the person has hypotension. But then we don't just check one BP and then diagnose someone of hypertension. No, but then I'm just trying to give you the words. Okay, the words that we use at the hospital setting. Okay, so if somebody has high BP, hypertension, low BP, hypotension. So we are done with all the components, but then in the hospital or at the hospital we add SpO2 to when we are checking vital signs. Okay, so for SpO2 we use the pulse oximeter to check for SpO2. Okay, and with that one the normal range is from 95 to 100. 95 to 100. I hope this is helpful to you watching this video, and please let me know if you want more videos about health. Okay, so my name is Lucy, a registered general nurse. Okay, please don't forget to like this video, comment down below anything. Okay, comment, and please don't forget to subscribe to my YouTube channel. Okay, please subscribe to my YouTube channel. Okay, I love you. Bye.